20% of Iraq and Afghanistan veterans have post-traumatic stress disorder. This may seem like a small number, and that's because it is. 50% of those with PTSD do not seek treatment, and out of the other half that do, only 50% of that get the slightest amount of treatment. While many will sit around and sympathize, knowing how our veterans feel, the actions necessary to treat the ones that have served and protect our country stand idle. While our voices stay quiet, families are breaking, and the ones who serve and protect are going unheard. While there are many types of therapy and medications offered to help treat PTSD, the number of veterans with PTSD outnumbers the amount of people qualified to apply these therapies. With numbers of therapies and medications being approved for the treatment of PTSD, there are two main types of therapy provided: between cognitive processing therapy, CPT, or prolonged exposure therapy, PET. These two have shown the greatest amount of improvement among soldiers on their own. Most are paired with depression or anxiety medication for a short or indefinite amount of time. The medications are only paired among soldiers with PTSD on the more severe side of the scale. CPT is a therapy that provides a way for an individual to provide a way to talk through your exposure and beliefs either individually or in a group session. Slowly, the therapist will help the individual bring out the thoughts and memories that are causing the trauma to resurface. Through this period of therapy, the individual will begin to build barriers between reality and the trauma of past events. PET is a type of exposure therapy that allows for triggers to be present. For most veterans, this involves gunfire or loud explosions. For others, it's visual. The use of virtual reality has begun to make these therapies more useful for the visual aspect. By allowing for veterans to stay in a quiet, sustained room, they can regain the feeling that they are associating with the situations in real life. After taking the time to acclimate to these situations, other parts of outside virtual reality will be set into stone. While these take time to work out what is truly going on within each individual, they will eventually be able to come back to reality and sustain the way of life they once left to protect and serve our country. Many know of the situations with medical marijuana being prescribed to quote-unquote treat the symptoms of PTSD. While medical marijuana only allows for the symptoms to subside for a shortened period of time, doses will slowly have to be upped and will eventually become not useful over time. When medical marijuana starts to fail, veterans start to turn to other drugs that they believe are a better relief from the stress they have and are still being put through. Without the help of a beneficial diagnosis, the therapy sessions, the likelihood of veterans getting better is slim to none. With the support of families, friends, and communities to lean on, many veterans have a better chance at finding the help they need. Many are scared to speak up about the feelings that they have on the inside, and fear they will be judged or not allowed the help they truly need. With many other therapies appearing in today's society and today's technology, therapy is becoming easier to find. The appearance of Weightless Warrior, which is a flotation therapy session for veterans with PTSD. Weightless Warrior has started benefiting veterans by allowing for them to be provided with free sensory deprivation flotation and therapy sessions. Weightless Warrior is a nonprofit available to veterans around the world. They have veterans journal before the first session, and after the first 5 to 10 floats, they then have them journal again using the same forum provided at the beginning of the therapy. The forum provided is a simple onboarding form presented at the start to allow soldiers to speak their minds about what is causing them to return to these situations. After the form is filled out, they are placed in a guided meditation to allow them to be eased into the flotation session. This is a simple and inexpensive way for veterans to take control of their thoughts, or at least start to what they deserve. While small steps are all that are needed to be taken, the action necessary to allow for veterans around the world to get to this place is crucial. When you're scared and unwilling in fear of being judged or looked upon as weak to their community, we can help them by assuring them that they are strongly appreciated what they have done for our communities and our country. Soldiers and their family need help validating that everything is okay with what happened to them, that it's not their fault. Communities as a whole have to remember that veterans with PTSD are not damaged, crazy, or defeated. They are inflicted with invisible wounds and overwhelmed with burdens of surviving every day.